So the topic that I'll be talking about now is mobility aids. So what are mobility aids? Mobility aids are two different terms like mobility and aids. We know what mobility is. Like mobility is movement and aids are like devices or equipments or tools, whatever, like assisted things, whatever we use are called as aids. Now combine both together like mobility and aids. So both are together called as the devices or tools which help in movement. So they are called as mobility aids. So coming to the mobility aids, the first question is, why should we use mobility aids? So what is the use of using mobility aids? Usually when do we use the mobility aids? We use it when we have some neuromuscular problems or the musculoskeletal problems, right? For example, if a person is having a fracture to the lower limb or maybe weakness of the lower limb, so then they'll go for a mobility aid. But what actually is the purpose of using a mobility aid? See, for example, like a friend of mine or someone from my family is having a problem in walking. Okay, let's just say they're having a fracture in the lower limb. Now they cannot walk. Now I can not be always available for them to like assist them to walk, right? Not just me, anyone from my family or friends cannot be like always available for them to assist to walk, right? So in such cases, like they can go for the mobility aids. So even if the person who is having a fracture or lower limb problems who cannot walk, they cannot like constantly call upon someone for help after like 4-5 times of assistance. Even they feel like hesitant to call them again, right? Call for assistance rather. So in such cases, we go for the mobility aids, right? So what are the functions of mobility aids? So the first function of mobility aid is it reduces the weight bearing on the affected structure. Obviously, like for example, my right leg is fractured. Now I cannot walk with my right leg properly. Now I'll use a mobility aid. I'll place it on the right side and all the weight that I ought to like place it on the right leg, I'll shift it to the mobility aid, whatever I'm using. So in that way, the weight will not be completely shifted onto my affected leg. Yeah. And the second one is it improves balance. Obviously, like a two-wheeler bike or a scooty or whatever has lower stability when compared to that of a three-wheeled auto, and the three-wheeled auto has a lower stability when compared to a four-wheeled car. In the same way, walking with two legs has lesser stability if you like adds upon like some assisted device. Like see, consider this assisted device or mobility aid as a third leg, okay? So walking with three legs has more balance, has more stability when compared to walking with two legs, right? So in that way it improves our balance and it also reduces the pain. See, when you're not actually applying the full weight on the affected side, so it's definitely impossible to like feeling the pain, right? So obviously there will be reduction in the pain. And lastly, we use it for musculoskeletal and neuromuscular conditions that we already know. So there are different types of mobility aids. Like we have the crutches, we have the canes, we have the walkers, wheelchairs, and braces and splints and prostheses. Okay, so let's just see the crutches. In crutches, we have like three types of crutches. The first one is the axillary crutch, the second one is the elbow crutch, and the third one is a gutter crutch. So let's just talk about axillary crutch. What actually is a axillary crutch? The axillary crutch provides a wide stability. Okay, it gives like 80% of the stability can be achieved through a axillary crutch. Now this crutch can be made up of wood or metal or carbon and glass fiber, even thermoplast. Okay, so these are the parts of the axillary crutch. It constitutes of this pad, okay, the crutch pad. Okay, it's actually made up of metal. The entire crutch is made up of metal, but in the crutch pad region we'll have a cushion. Okay, so and we have a hand grip over here onto which the patient holds on, and if you see here we have the adjustments, okay, so that you can adjust the hand grip depending upon your height and comfort and whatever. Okay, in the same way we have the length of the crutch can also be adjusted or altered. We have the adjustments over here. With this we can adjust the crutch, and also in the end we have the ferrule. Now what is the use of this ferrule? It is made up of rubber and it helps in maintaining the grip. See, let's just imagine a person is walking on a slippery surface with a crutch. Okay, the surface is already slippery and the crutch doesn't have a proper basement like a rubber or something for the grip. So obviously the person will fall. So in order to prevent this, we have these rubber ferrules placed at the end of the crutches, not just crutches but to most of the mobility aids we'll see the ferrules. Okay. So the measurement. See, measurement of the crutch is very important. Doesn't matter how good the crutch can be adjusted. Now see, you cannot give a 5-foot person's crutch to a 6-foot person. Right, that much of adjustment cannot be done in a crutch. So in that cases, so not just in that cases, in general only, whenever a patient comes to you and if you want to deliver him a crutch or if you want to prescribe him a crutch, you should definitely go for the measurement of the patient. Okay. So how is the measurement done? Now the measurement can be done with shoes on and shoes off. Okay. So, and in both the situations you can place the patient in supine, or you can just make him stand and you can take the measurements. So, in the shoes off situation, in supine lying, you ask the patient to lie on the couch, you just take off the shoes of the patient, and the measurement has to be done from the apex of the axilla to the medial malleolus of the same side. Apex of the axilla to the medial malleolus of the same side. And in the standing position, we ask the patient to stand, remove the shoes, and the therapist should measure from 2 inches below the axilla and 2 inches lateral and 6 inches anterior to the foot. See, I am again repeating it. In the supine position, the measurement will be done from the apex of axilla to the medial malleolus of the same side. In standing position, the measurement will be done 2 inches below the axilla, 2 inches lateral and 6 inches anterior to the foot, right. With shoes on, in the supine position, we make the patient sleep on a couch or lie on a couch, and we ask the patient to put on the shoes, and the measurement will be done 5 centimeters below the axilla, 5 centimeters below the axilla and 20 centimeters lateral to the heel of the shoe. Okay. And in standing position, the standing position of shoes on and shoes off are same. You will measure from 2 inches below the axilla and 2 inches lateral and 6 inches anterior to the foot. I think it's better if you just look into the picture. So these pictures are the measurements, how the measurements are done. Okay. And then we have the measurement of hand grip. Okay. So in the measurement of the hand grip, we first ask the patient to flex the elbow to 20 to 30 degrees. After flexing the elbow, the measurement should be taken 5 centimeters below the apex of the axilla, to the ulnar styloid process. 5 centimeters below the apex of the axilla to the ulnar styloid process. Okay. And next, coming to the elbow crutch. So elbow crutch has lesser stability when compared to that of the axillary crutch. The stability is just 60%. Okay. And the materials that are used to make the elbow crutch are metals or plastic. Okay. So this is the elbow crutch. Like if you see the parts, it constitutes of a cuff. Okay. So the cuff will be like this. Okay. It will be circular like this. The patient has to put the hand through the crutch and he'll hold the grip that is present down. See, this is the cuff. The patient will place his hand through the crutch and hold this hand grip. Okay. So that's how this crutch works. And then just like the axillary crutch, we have the ferrule over here, and here is the adjustment buttons. The length of the crutch can be adjusted here. Okay. And also the cuff edge also can be adjusted. Okay. And coming to the measurement of elbow crutch is done by asking the patient to flex the elbow 20 to 30 degrees. Okay. After flexing 20 to 30 degrees, the measurement is done from the ulnar styloid process to 20 centimeters lateral to the heel. Okay. Here in the axillary crutch, we have the measurement that is done 5 centimeters below the apex of the axilla to the ulnar styloid process, and in the elbow crutch, from the ulnar styloid process, the measurement will be done 20 centimeters lateral to the heel. Right. So the last type of crutch is the gutter crutch. Gutter crutch is like a beautiful invention done. So in the gutter crutch, actually we usually prescribe this crutch or suggest this crutch to the people who have problem in holding or bearing the weight on the hands. Like in the cases of rheumatoid arthritis or patients with hand or wrist fractures and dislocations, they actually cannot bear the complete weight on the hands or wrists rather. So in such cases, we go for the gutter crutch. Like if you see the image, this is the gutter crutch. As you can see here, this is the hand pad. This is the hand pad. The patient places the hand on the hand pad and holds the hand grip. So in that way, lot of weight is not bared on the hands, so the patient doesn't feel a lot of pain. Okay, so that is gutter crutch, and the measurement can be done in standing position and lying position. In standing position, we measure from the elbow to the floor. Okay, we ask the patient to place his hand down, and from the elbow to the floor we'll measure. Okay, in lying position, we ask the patient to flex the elbow, and from the flexed elbow we'll measure 20 centimeters lateral to the heel. Right, that is the measurement done for gutter crutch. So there is something called as pre-crutch training. What is pre-crutch training? See, now we cannot like prescribe or we cannot like suggest crutches to every single person. Before like suggesting someone a crutch, there has to be a proper assessment done. We have to check if the person can actually like walk with a crutch or not. Okay, so what are the criteria to check or to assess the patient for pre-crutch training? Okay, the first one is psychological status. Psychological status is very important. See, if you go to some person, if some person comes to you and says that see ma'am or sir, I cannot just walk, I need some help, and then if you prescribe them a crutch or something, the first thing they say is no. They'll say that, they'll straight away say it on your face that they'll not use the crutch because of social stigma. At least they'll say that I cannot use it publicly because of social stigma. So the first thing that we have to keep in our mind is we have to encourage the patient. We have to like make him feel confident to use the crutch, and also the proper like precautions and of course the risk that the patient would have if he doesn't use the crutch should be properly explained to him or her. Then only he will use. So you have to give them a proper psychological counseling. Okay, that's number one. And second one is balance. Before giving a crutch to a person, first assess the sitting balance and standing balance. See, if a person cannot sit and stand properly, it's very obvious that the person cannot sit and stand with the crutch. It's very obvious. He cannot stand and sit by himself. Now, how can he just stand and sit with the crutch? That will be a big task for him. So, if the person is having the balance issues, first train him for the balance and then give him a crutch. Okay. And the last one is strength of crutch muscles. Now to use the crutch, you will need some muscles. There will be like activation of some muscles, and the strength of these muscles should be appropriate. Okay, how do you know if the muscle strength is appropriate or not? You will check it with the help of MMT. Okay, and if the grades are lower for any of the muscles, then firstly train the muscles. You can train them through any procedure, like you can use PNF techniques, weight cuffs, TheraBands, resisted exercises or isometrics, anything of your choice. First train the muscles, strengthen them, and once after the muscles get strengthened, then give the patient the crutch. So the things that you have to keep in your mind are sitting balance, standing balance, and the crutch muscle strength. Okay, so what are the crutch muscles? The shoulder we have the depressors, extensors and abductors. Elbow we have the extensors, wrist extensors, finger flexors, hip extensors and adductors, knee extensors, ankle plantar flexors and toe flexors. All of these together are useful for the movement that is achieved through a crutch. So properly assess all these muscles, train them if necessary, and then only prescribe the crutch or suggest a crutch. Okay.